Seja muito bem.
Welcome to the second part of this first day of EHEALTHSUMMIT.PT. We'll continue to have debates, share ideas, knowledge of what's been happening in Portugal in the fields of digital health. We open the second part with a panel called the debate panel moderated by Domingos Pereira, member of the board of the SPMS. I'll call him on the stage. He's going to talk about the electronic health records. I'm also going to call José Nascimento from the University of Minho, who will be with us long distance thanks to technology. António, who founded chapter HL7, and José Luís Biscaia, executive of the health group of Lower Mondego, a doctor. Thank you to all of you for being here with us in this initiative. Good afternoon to everyone. Thank you for being here. As you well know, SPMS makes available nowadays electronic health record, which is particularly useful to our professionals who lives in the hospitals, knows that whenever there's a problem in accessing RSC, the professionals immediately complain to the records. This is a particularly helpful tool, therefore. Our e-health record has some characteristics. It has a set of pointers and links for 76 hospitals, 491 intensive health care primary care units, and it's basically contains the following information. Information of the institution, well, the healthcare is provided, the specialty, and the time, and the place where the care took place. This is a component that is the patient summary, which is also a very important tool that has all clinical and administrative information about the patient. It is also built when it's requested, meaning the patient allows it to be built, and the health practitioner in his care point can call it. And there is a document, a clinical document, that allows us to obtain a set of information that is part of what is called the patient summary. The question thus is, how do our guests think this electronic health record should evolve, as it is so helpful and useful in the arenas of in Europe, and in eHealth Network that on this topic has produced intensive work. I would now pass the floor to Professor José Nascimento, who's been working on this since 2009 and is now in Centros. Thank you, dear friend, engineer Domingos Pereira. I'm very sorry for not being there. I'm in Centros, where the Lisbon Declaration was signed, digital democracy against the backdrop of the European Commission, and that's what prevents me from being there where I'd like to be. My speech will be for a set of pairs on the digital transformation in health, and it's the pair of being here. So I thank you very much for the invitation by SPMS, and I take this opportunity to express to all professionals SPMS my heartfelt thanks for all the work over the course of this 1.5 year of pandemic. Engineer Domingos Pereira is also the chair of the Association for the Intelligence Information Services for Health, and through him and all the professionals of information services, of health. We're all in recognition when we thank the health professionals, and we like to thank the people of the information systems in the health field. I would like to share a screen. This morning I only had one slide. I know it has two. I expect you to see it now. I will be speaking for 6-7 minutes on the set of digital transformation and as regards the electronic health records, but I added an extra slide, because today I was listening to the President of the European Commission, Ursula von der Leyen, and when she mentions 4 major challenges in 4 fields for the digital transformation, capacitating people, companies, and services, namely public services. When she mentions public services, this is her sentence. These are her words. When it comes to empowering, in 2013, all European citizens should have access to electronic health records. And it's important, and it's a paradigm that this topic has been chosen by the President of the European Commission as an example of public services and how digitalization is important. I have the pleasure of being here, and I also would like to talk about research. I have academic bone. And this is an ecosystem. It's also a European task. We'll get to it later. And I think it's important that we have a memory and keep it, all that has been done against the backdrop of electronic health records that Domingos, Pereira, and even José Biscaia also have worked on. This is what has been done against the backdrop of PDS, and also in the times of former times, external work. There's a good academic work on that topic. In 2 weeks, there is something from ARS North will come out. I found this week a paper on blockchain and health made by a young man who is now working in Infarmed and wrote that dissertation in the University of Beira Interior, documents from Deloitte that are extremely interesting. And someone saying, as Isaac Newton saying, if we want to go far, let's follow in the footsteps of giants. We have to look at the policies too, because I think we should have a strategy for the electronic health record. I think Europe will give an important contribution into our strategies. It should be aligned with Europe, our strategy. I'm not talking about the strategy as PMS. It has its own policies and strategy. I'm talking about a strategy about the electronic health records that has its own policies and its programs. And each project should be framed within this context. If you allow me very quickly, and I promise to be quick, sometimes I play a trick on my colleagues, on my students, undergraduate and graduate studies, which is asking if they agree or disagree with the current policy of data sharing between the private sector, the private sector, and the health sector has a very interesting experience. But when I tell them, I tell them, I don't want for your opinion. Do you agree or you don't with the current policies? Usually there's a silence that hovers it's important that we're guided by policies. This is an important aspect for an electronic health record for the upcoming decade. The European Commission requires from us, Portugal and the remaining countries, to have that. And that strategy is relevant, especially it's important that it's known. I would like to enhance an aspect here, which is it has to do with the fact that, oh, I lost something here, says the speaker. I was saying we have to keep in mind that this is these are very difficult times in the pandemic. There has been a number of endeavors, but we have to draw a solid strategy, and it's important to do it, I would say, with a participation, an engagement of everybody. This is important in such an important ecosystem. And we have to define this strategy, outline it with everyone. I recall that Domingos Pereira a few years ago, the speaker is making a pause. There was a technical problem. The slides were not passing. A few years ago, Domingos Pereira spent some time in Denmark. And when he came back, he had a session that she shared with us that had to do with healthcare practitioners. He spoke at the hospital of Gondomar, and what I recall is that his message was that there should be a policy, a long one, a 15-year policy that is built by people. So it's important in this strategy and in these policies to involve all the agents, Infarmed, SPMS, the hospitals, and also the public sector, the private sector, the civil society. And this has to be a co-creative process. Now, there's I want to talk about health professionals. They have a particular weight in this engagement because digital transformation, the way we understand it, that it should occur, which is to innovate and create new processes, it necessarily entails with the participation of the healthcare professionals, their engagement. This is also a strong message that I wanted to leave. I'm about to conclude. I would like to say that it's important because we're talking about an ecosystem, and it's also against an academic background. There should be papers published on what's going on. And I would leave this suggestion, SPME or any context, or building a repository on the information that is being built in this field, because people who work in this field, they know what has been done. And then I would like to mention something that has to do with Europe. After what the President of the European Commission said, I think this is the right time, and we are well on time to build the future of the electronic health records, not only centered in Portugal, but also thinking of what the fact that we will move around after the pandemic. And we'll have access to cross-border health services. And to conclude, last but not least, there's an initiative promoted by the Minister of the Economy. We have to address competitiveness. There is not a health system, a modern one, without a competitive economy. So it's important that we think, in the case of health, the companies should have an important role. The health businesses, our competitiveness as a country in Europe requires that we have an electronic health record so that we have exchanges with the companies and cooperate with them so that they can follow what's being done, so that they can have products go on the markets, go to Portuguese-speaking countries and in Europe and be competitive in the global market and bring to Portugal the wealth that we need so that health and the National Health Service may be upholstered, reinforced, and with a quality in their service that we all desire. Thank you very much for your kind attention. Thank you, Professor José Carlos Nascimento. Now we pass the floor to Engineer José Carlos Matias from Chapter HL7. Good afternoon, everyone. I'm going to speak about the electronic health record. Is it a desirable progress? I will give it a more technical undertone on how we can look at it, how we can frame it, but also from the technological standpoint. I'm not going to enter into too many technicalities, but let's talk a little bit about the technical aspect and rough strokes. This slide shows only a small summary of how a hospital, healthcare provider is exposed to the kind of devices. There has been a list of the systems that gather the information, process it, and present it to the healthcare practitioners so that they can conduct their work on an everyday basis. Interestingly, there's dozens of apps for healthcare providers, and there are hundreds and thousands of different apps that collect information, process it, and potentially they should make this available for an electronic health record at the service of healthcare professionals and also of patients. I, as a patient, would also want to have an active role and be able to consult my healthcare record. There are many approaches. When people are taking different attitudes, they will want to have to look at the information in different ways. But the producers of the information are by the hundred, by the thousands. And so it is necessary that all this information can be channeled to the places where it's going to be necessary. What does a healthcare practitioner, what will he need? We don't want to use dozens of different apps, do logins and remember 30 passwords. One app to prescribe, another for the test results, another for a consultation and to identify the patient. And having to do this 20 times doesn't make any sense. It's not what the healthcare practitioner was initially trained for. It's not his role. What he has to do is use this technology as a tool to produce better healthcare. So the healthcare practitioner will want to have the information in one single place, have the information pre-processed according to the function, to his task. So if the information is being shown to a patient, the information should have a certain format, different from the one that is given to a doctor or nurse or any healthcare practitioner who will see the same information but in a different way with a different purpose. So we'll reach the typical problem that the information is gathered by dozens or hundreds of apps, but oftentimes it's not those apps that should or need to process the information. Regrettably, in many cases, what we see is that the app that gathers the information is not the one that will have to later on show the very same information, or the one that is gathered the information needs to go through a washing machine to be processed. processed and then be presented to its consumers. So we have a problem. If there is not an interoperability between the various apps in the scene, there will be difficulty. The information will not flow. If it does, might be exposed to many problems. We can also see that the app that gathers the information, the one that needs the information, but actually, if it had that app could present the information in a more focused manner on the goals. Let's imagine an app that had to do a post-processing, a special one, to be able to better diagnose a certain disease. The information would correlate the lab tests with the medical images that would lead to new knowledge that without having this cohesion of information, we could not have reached the same conclusions. So therefore, my suggestion, and the one of many technological professions in this field, is that we should use norms to promote interoperability. There are many norms, but the general goal that I would like to enhance here is that the norms may seem more expensive at first, but their use in the long run is much cheaper and would make us save a lot of money and resources. They're apparently more complex to implement because the norms usually have annexes that include a lot of documents that explain them, and they're thought to function in a wide range of sets of to be used. And if we want the information to flow, we'll have to read a number of norms and all the documents. We'll have to read all the norms that allow for that to happen, and we'll be wasting a lot of time than if we wanted to invent something. So the norms are thought out to be adopted in many cases, and they are voted by experts worldwide that more know about that topic. It's not something that's done by people that get together for 4 or 5 hours in a meeting and come up with an initiative of interconnection of implications. Usually these norms progress or evolve over the years. They're optional. Only those or the entities who prefer it will adopt them. However, they'll bring in enormous benefits. Usually, besides documents, they have the support of the communities over the internet. Many people across the world who know and understand about the topic, and they understand that it's the best practice to carry out a given activity. So this just to give you an idea that we really need interoperability. It's a key to obtain the electronic health record in this country or any other. We do need to achieve an interoperability, have the information flow between the various entities that produce the information and that consume it to help us make better decisions, help in public health, and even entities that are not the healthcare providers so that they can process that information and produce very interesting new knowledge, very important for medicine to evolve, and also for the evolution of the transition of digital transition that we've been witnessing in the past few years. This is basically what I wanted to tell you about the relevance of interoperability. I represent HealthSat Portugal. It's a non-profit organization, and the only aim of it is to promote interoperability of information in the health field, in the health sector. It's an association that is not for profit, and our only mission is to achieve that apps in the health sector can communicate information in a simpler way and reach better results. Thank you, Engineer António Martins. I would now pass the floor to Luís Biscaia. Good afternoon. It's a pleasure to be here in this SPMS space. It's been happening in the past few years. It's a privilege. I would like to talk about the topic from my standpoint as a doctor. When I saw the title, I wondered. electronic health records desirable program, doesn't it lack a pronoun? Is it the desirable progress, or what desirable progress? Well, I'm going to show my vision, what I think should be the progress, and it's important to me to make a public statement. I think the electronic records are the most structuring elements to modify the health services in the upcoming years. We have been centered around the digital transformation, and I'll present my view. As a doctor, these records, electronic records, serve something. They're not an end in themselves. So they serve health, and our challenge today is how to respond to the itineraries of each person. Well, we have to be born well, die well, and live well. How do we solve these problems between health and disease in every day? How can we do this with the support of technology and the electronic records? Well, we have to look at the primary healthcare in hospitals. The itinerary of each one has interventions of health. It can be primary prevention, and we have to have information about what happens so that I can intervene in the risk factors, precocious, early early diagnosis, any kind of how to avoid heterogeny, to qualify our practice for the darkest situations. It has a fourfold dimension. And this managing of the itineraries, we have to be qualified. We have to when it comes to integration and interoperability of the information, we have to see how resolution. We have to respond to the problems the right time and the right timing. And we have less diseases, but we don't have less patients. This is a challenge that can be objectivated, and I think our society is clear on three fronts to promote health. This has to do with the child development and active life, to integrate healthcare, the integrated management of itineraries. Excuse me for repeating myself. It's very clear that we stop discussing primary care hospitals or the social aspect. What we have to do to think is, how do I respond to people when they have a given problem, and look after the major problem of our days, people with multiple morbidities. This frame needs two things that we don't have much in Portugal. One is we have to understand that this change is adaptive and a route each one. We cannot change this very complex system without having an adaptive policy. Well, I know I want to go that way, but I still don't know how to do it. So we have to be cooperative and be intelligent about it. So we have to have access to information. And so the electronic records have to do with this topic. I think it's interesting to put the person, the human being, at the center and see what happens over the various stages of life and have this information flowing. So 2 slides to have an overview of the electronic health records. So I suggest a concept which is it cannot be exclusively a set of data that exists somewhere that I have access to during a consult. It's all the information. It's a functional view. All the information that it's available throughout my health life as a patient or not, and the exchanges I have with the various health practitioners. It has very functional concepts that are important to understand. There has to be a transaction because I have to complete, correct, interact, qualify information, and that's what this is all for. This functional concept, I would isolate 3 components. My life history, what do I want to do? What do I bring with me? My diseases, my goals, how do I want to change? Do I want to lose weight, do more exercise? Am I hypertensive? Am I a diabetic? What do I want to do as a citizen, and the professionals who help me in that issue? It's the integrated management of itineraries. There has to be, everything has to be interconnected. The electronic health record, and how do we run the agenda, the itinerary? How do we communicate with the services? How do I schedule? How can I have a planning for discharge? Or I have to see if everything is taken care of ahead. So it's a crucial topic to link to this. This is crucial to link to the electronic health record. And then finally, the support to clinical decision. It's an element of literacy. It's crucial to have this record, not just as a set of data, but I have to interact with them if I'm a citizen or healthcare practitioner. If I have information, especially manipulating and transacting information, I have to have things that help me, that make me more capable to make a decision. Me as a profession, to see what's my profile of prescription, what I can do, how can I share information with something who is so different, who has a problem that needs to be addressed. And so this support to clinical decision is a crucial element. Of course, when we are talking about these electronic records, there's a number of dimensions here in this audience. Some people are a lot more technological than me. I'm not going to waste much time on it. So 3 or 4 things are important to leave open for reflection. We cannot think about these records without thinking, how is health going to be in 2-3 years? So the portability, mobility has to be foreseen here and now. I know we can't think about these records as something that is done, concluded, something that I cannot have access to. I have to see how it's going to follow my life. And the interoperability has been addressed, which is obvious for everyone. It has to exist. And this interoperability integration is not just technological, it's also semantic one. The health professionals, I always found it very bewildering. They have sometimes they don't work together. They're not agile. There's each specialty have their own clinical process, and this is a mistake. This is just territory. We're not focused on people. I can have the nomenclatures, but we have to blend them. There has to be a semantic integration. So if I'm a diabetic, the problem is still there, but we have to add what the different scales that each patient needs. So every time I mention this, and with health care professionals, there's always the temptation to be like an encyclopedia. Today we have to think of all the scales of the information that's going to be crucial. So I have to have electronic engineers on one side, IT engineers, and so that in 2 or 3 months I have to see that there's a new scale that has been validated, and I have to be able to include it in this process without having to change the entire app. This is the major change and challenge. So this is personalization, parameterization that need to be done, and many other dimensions. So we have also mentioned about these records, and oftentimes forgotten another aspect. We have taken strides in Portugal, like the pandemic has shown, which is the management of knowledge. We took some leaps in the past few years. In the past 10, 15 years or more, we have plenty of data, not too much information, and we don't manage knowledge well. And that's very sad. It's hard for us how we saw what happens with the major choices, with the management of vaccines. There's also a number of problems. How am I vaccinating? How am I doing it? So we have to understand that development of these electronic records have to have this component that I call it a device for knowledge management that has to include all that. All the actors, including the citizen, they have to be part of the process and have access to information. Sharing is important. It's to empower us. It's also a matter of literacy. And in case of the organization, contribute to improvement. I cannot discuss my good practice if I don't have access to information. If it is not structured, organized, it has to be easy so that I can understand what I'm doing or not. And then, of course, there's another dimension, which is transparency. We've taken some strides in that respect. And by defining these concepts that are more functional, or by identifying them, there are 3 things that are very important. The first is this means that we have to redesign the processes. And what has been happening is that every time we develop an app or talk about it, we don't discuss the process, what is going to happen next. And so we put on a digital platform on a computer what we do with on paper, how we schedule the appointments. We don't redesign the whole care process. So this is a requirement that we have to think forward, going forward. Another one, and it's also written on PRR, is to overcome the technological deficits in our database, in our network. It's written on the resilience plan. It's identified as a major challenge. Everybody knows about it. And once and for all, we have to have the courage that if we don't do it, well, I'm talking about technology and the basis that exists. And if you don't do it, a third topic, what is the governance model? And here there has to be a vision, a future. My vision is probably not the same as yours, but to me it is clear that in this case of the Portuguese ecosystem, if you will, a structure as PMS should clearly be a regulator and not just a software house. We have to be clear that they have to say what are the terms of rest and how the system is going to be governed and create space or potential in this ecosystem. A very simple vision, what could be seen from the practical standpoint. My electronic health record is basically my life, and it could be filled in with all the events that happen over time, with history, diseases, social issues, and economic ones, and can be filled in a much easier way, in a timeline that can be increased. And so all of those aspects can be added to and accompany my life, and have a way of bringing together the information and group it, functionalities, if you will, that have to do with the list of problems, my profile, my social professional characteristics, the economic, cultural, social, how do chronic medication, many topics that can be identified. And just like this, there would be many different visions about the information according to the profile of the profession that we reach out for. So from my standpoint, I think this should be the major goal in the short term. So this is the last slide. I think this electronic records would be the great challenge for the digital transition in the short term. And I was worried when I read the PRR. There are 300 million there, and there's something that says information system of the primary cares in hospital. It's not electronic records. They have a number of relevant things, cyber security and so on and so forth. But when it comes to investment, there's human resources to do a set of things. There's another component for hardware, machinery, but this is the challenge I would like to. What I think the major focus for this digital transition that is there as an instrument, it should be the construction, the building in 3-5 years that Portugal should have an electronic health record. This is a comprehensive vision with everything that is there. It's important because the PRR must have had surely the opinion of SPMS. They were heard, but I'm sure it was not the Minister of Health who wrote it down. Someone wrote that, but SPMS cannot be left alone. So we have to realize where is the political leadership for this topic for the upcoming 3-5 years. Like José Nascimento was mentioning, the policies that he identified. So it's not just SPMS who has to understand the strategy and the 300 million. What are they for? The professions and the organizations, I as a healthcare professional, we have not helped this topic. We are in our small territories, our logic, and we don't have a systemic vision, a comprehensive one that would help to build farther. And we have to bring together the universities and the companies. When it comes to governance model, I cannot understand the way SPMS has been evolved. And this is a topic we have to see how we do it, how do we go forward. So SPMS has to be a strong regulating entity. So it's all about the data. It doesn't have to be a software house. We have to take advantage of the external knowledge, the companies, the universities, the professions, everything so that with the right framework, we can build something. We need a design, a purpose. We have to understand that in 3, 4, 5 years, we have to have an electronic health records. And so we can all benefit from it. Thank you.